Brought to you by Get the Message Out. If you've spent more time thinking about starting a podcast or YouTube channel for your association, your academy, your section, your business, if you spent more time thinking about it than actually doing it, congratulations, you're normal. Get the Message Out. That's my little company. We help you finally hit the record button and look legit. You get to be the sage on stage, be the thing your audience sees. We do all the stuff that in the background that you don't want to learn how to do. If you want to learn how to do that, you want to start it now, email me now, jimmy@ptpintcast.com, and let's make some noise together. Do want to thank some of our sponsors, Brooks IHL. They got one mission: turn good PTs into clinical leaders. Their residencies and fellowships give you real mentorship, evidence-based practice, and the support to level up. If you're ready to grow as a clinician, head to brooksihl.org. That is brooksihl.org. All right, if you think you need another specialist certification to treat someone with Parkinson's, or that RTM is just another way to squeeze in some extra units, this episode might change your mind. Today's guest is the kind of PT who's helping the profession meet the moment from the clinic to the classroom to the emerging world of digital health. He treats movement disorders, teaches students, advises clinics on RTM, and still somehow has time for disc golf. From Arkansas to AI and everything in between, let's bring in our guest, PhilMcKelvy. Phil, welcome to the show.
Thanks for having me, Jimmy.
Got a lot in there. I do want to start with the most important. How do I get better at disc golf? Because I'm good at throwing frisbees, but for some reason I'm terrible at disc golf. What am I doing wrong?
It's very different. Yeah, it's all about the it's about the technique. They're more like airplane wings than regular frisbees. Yeah. So,
well, because they're all
there's lots of great YouTube channels out there that can help you. Come to Arkansas.
There we go. Around. It's a great sport. So Phil, snapshot of you. Like, give people the what's your superhero backstory so people catch up besides disc golf?
Yeah, so I'm a PT in Central Arkansas. I married one of my PT classmates. We've been married for going on 9 years. She's an awesome therapist. And then we have 2 kids. I treat primarily neuro and vestibular disorders now, though I started out like your typical sports ortho guy out of PT school for more of my career than I've done this. Just had a little transition change. Mm-hmm. And then I got interested in kind of the digital side of PT with an article in the APTA magazine about RTM. I'd randomly read it, and I've just kind of been running down that rabbit hole for a while now, and it hasn't stopped me yet. So
you've also got a little more family tree and little PT.
So I do. Yeah, absolutely. Yeah. So my father-in-law is a PT in Southeast Arkansas, owns a clinic. And I actually have a cousin-in-law who's a PT in Texas. So there's a lot of us.
Did you ask permission before you popped the question to your PT school classmate? Was that something that you did?
I did. I asked her mom and her dad together because I knew that'd be important to them.
As I asked that question, I was like, man, he might say no. And I'm just.
Yeah. Then what do we go? Yeah, I did. And
that must have been cool for him. And, maybe we'll get him on the show eventually later, but that must have been cool from a side note, which is like, that's awesome. Like, she went to PT school and look at that. She found another one of us. Or was he like, hey, never going to be a millionaire. We're going to do good in the world, change the world. But man, wouldn't it be great if,
Yeah, no, he's an awesome built-in mentor. He's someone who's been in the profession for a long time, but never became a dinosaur, just keeps learning. So I've thrown so many questions at him over the years that I've been glad to have him in my corner. So
that's a great point is dinosaur doesn't actually only mean old. When you're talking about someone who's old and crusty, there's a lot of people who I know who are, quote, older age-wise, but they do not give dinosaur vibes. And you're like, that's awesome. Like it's a choice,
life goals.
Right? Yeah, it's a choice.
You just got to stay plugged in and keep learning.
Yeah, which is why you could subscribe to this podcast just by going to Apple Pod. No, okay, but it is a good point, which is like the people who listen to not just my podcast, but podcasts in general, or seek those things out. They're active, not passive. Those are the people who don't get crusty and rusty. Like typically, it's not just you pay the $2,000 for the weekend course. It's what do you do the other 364 days a year? Can you dip your toe? All right, enough patting podcasts on the back. Let's go big picture question first. What do you wish more physical therapists understood about treating patients with Parkinson's disease? Especially, we talked about this before we hit record, especially generalists who might only see it once in a while, who might be like, I'm picturing some of my PT school classmates, I'm an ortho bro. And then they look at their schedule and they're like, oh, what's this? What do you wish those people knew more about that?
Yeah, and those are the exact people this is for. This isn't for your neuro experts. They probably know more than I do. I've done, certifications on Parkinson's. I'm not against those by any means. I'm all for the amplitude-based training, the power, the big, all that stuff. But if you're a generalist and you live in a rural area, or you live in a city and this had this relationship with someone, they developed Parkinson's and they want you and no one else, you need to know that you just need to bump their intensity on whatever they enjoy doing. Especially if you're a rural therapist, you got to find out what can be done safely for them. And maybe that looks like an exercise bike, but that doesn't look like an exercise bike just pedaling around in a circle for 10 minutes. That looks like doing interval sprints where you're 20 seconds on, 40 seconds off, as hard as they can go, and then coasting, hard as they can go and coasting.
Oh,
yeah,
Phil,
right.
this sounds like a hit workout, bro. What are you talking about?
It is a hit workout.
Ah,
yeah.
look what we got there.
Yeah. So if you're an ortho bro and you've ever worked out a high level athlete and taken them through some cardio return, like you can do it. I'm not saying you're going to be as good as someone who only does this all the time, because that's impossible, but you can give that person meaningful neuroplastic change and drive a really good session and change their perspective on exercise, whether you have done LSVT big, power, rock steady, or just kind of, know how to work somebody out, get them in 13 to 17 on the RPE range and keep them there. And that'll get you 80-90% of the way there.
This is by no means, knocking the LSV, the power, the rock steady.
No, I use it every day. It's
just saying that you probably have more skills in your, oh gosh, I hate when you probably have more skills in your toolbox than you give yourself credit for. It might look different, but you probably know. So you mentioned intensity is greater than protocol. Frequency. So let's see if I can remember these things. And my ex-phys professor will be excited, Sky Donovan. Frequency, intensity, time type, volume progression. Those are your tools, man. Those are 7. Yeah, Fit VP. Those are your 7 dwarfs, right? So you're saying, so if you had to rank them, you're supposed to love all your Fit VP equally. But what is the hierarchy of this? You've already said intensity, so we know the I is probably up there. What comes next?
It's probably number 1. Frequency and time. So Parkinson's Foundation recommends 150 minutes a week for someone with Parkinson's as the floor. It is a lot. It's 30 minutes 5 times a week, and moderate to vigorous intensity. So getting going where you could maintain a walk, but you're having to talk a little bit like this, maybe something in along those lines. Yes. And then the type to me is a little less important. It's whatever is going to get you exercising that much. The aerobic is the one that's talked about the most. And I think that falls back to, that's just the easiest to research. If you're a former lifter and you want to get into some lifting, like still do some aerobic, but go ahead, lift some weights, knock yourself out. Don't really, but if that's what's going to get you going for 150 minutes a week, like we need to get you going for 150 minutes a week, because the thing is, like, if you're not doing it, it's not going to do you any good. So if I tell somebody you need to get on a bike 150 minutes a week or go for a walk 100 minutes a week, what's the point?
Yeah.
I got to it could be dancing, ballroom dancing or something like that. Like, it doesn't have to look like exercise. It has to look like intensity, heart rate up, like moving quickly.
Yeah.
But yeah, that's where I would rate the most of those things.
Yeah. What's the best exercise to do for insert fill in the blank? The one you like doing, the one you're gonna do, right? Yeah. I got a brother
that research in like low back pain for years, right? Like getting people moving, like whatever it is, if they're going to stick with it, it's going to do better than like maybe the perfect thing that they never do.
Yeah. The perfect exercise you never do. I know it's better than that. Is the pretty good exercise that you do a lot. My brother's big, man. He's 6'4". He's a big dude. He just doesn't like lifting that much. So he'd rather go skate at our local rink and he likes the Stairmaster for some reason. So he goes, is that bad for me? I go, Stairmaster it up, bro. I'm like, Stairmaster up. Now, you want to get stronger on the ice, you want to skate faster, I want you to do some single leg stuff, or I want you to deadlift or squat. But like, if you don't like it, me throwing it at you, now it feels like I'm judging you. Now we get into psychology of it, I bet.
Which really matters.
Which really matters too.
And it especially matters when you're talking about someone who suffers from a disorder that causes apathy and depression for a lot of these patients. So if, it's hard enough for me to go exercise and I don't have something like that hitting me down, a good percentage, I don't know the numbers, but these patients will deal with one of those two symptoms for
what were they again? Apathy and
depression.
Depression. Makes it hard
can
to
go
get to
along. Yeah, it's hard to get moving for anybody, but if your diagnosis is making you a little apathetic, like I just don't, how are you going to get that person to exercise? And giving them something that they enjoy doing is going to really help get them going a lot more than just giving them the perfect stuff.
Yeah. We did mention things like Power, LSVT, Rocksteady.
Yeah.
What's and believe me, I've only heard good things about neurotherapists who've gone through those. But what's a step before that? What's the first date? Is there something free? Is there someone with a badass YouTube channel or a badass Instagram? What do you got?
Absolutely. There's some good free stuff for patients and clinicians. I really like Rogue Physical Therapy. They're in Orange County, California. They're in a big enough area where they just specialize in people with Parkinson's. That's all they do. And it's a lot of cash based. I think there might be some insurance based stuff there, but they have a free YouTube channel and they have a paid YouTube channel for patients. But if you're a clinician looking for some exercise ideas or a person with Parkinson's looking for some exercise idea, go hit up their free channel and good artists create, great artists steal. Just take a lot of their ideas and put them in with your patient. And then there's one called Power for Parkinson's out of Austin, Texas. It's a nonprofit, POWER, not the Parkinson's Wellness Recovery Parkinson's. They have a lot of chair-based exercises if that's the appropriate level for your patient or your loved one with Parkinson's, and that's all free stuff. So eat that up. I don't want to hype too many podcasts on your podcast, but the I Love Neuro podcast has a bunch on Parkinson's.
They're great. Yeah, they're great.
That would be like those 3 resources. Just go to I Love Neuro and scroll through there. You're going to see within a year 10 Parkinson's podcasts. Pick one on a topic that interests you and give it a listen.
Always hype other podcasts. I think
that's right.
All podcasts raise other podcasts. I do not think it is not
that's
cake.
Right.
If you listen to one podcast, it's not like there's less cake for other people. It's like more breeds more. Breeds more.
Yeah, rising tides raise all boats.
Do not disagree there. Definitely agree. What else am I not asking about this? Because we're going to switch topics, but I want to make sure we don't leave this until you're like, well, I really wanted to talk about this. What is the last thing you'd say to maybe this avatar of outpatient ortho person who might have someone on Parkinson's on their schedule? Anything I didn't ask that opened a door for you?
We covered most of it. I would just say don't be afraid to push these people. They may seem like they're not there to work hard. I work with them every day, and I can tell you, like, they're some of the nicest people I ever meet. I don't know what that is about someone who suffers from Parkinson's, but they tend to be incredibly nice, and they tend to be willing to work incredibly hard because they see the benefits and know the benefits. So don't feel like I can't push this person because, they're 70 years old and they've got a tremor and they've got this flat affect. Like, that person can go. They will go if you just coach them to get there, progressively load them to that point. But don't feel like you can't push someone with Parkinson's.
Do not underdose. Safety first.
That's right. Safety first, of course.
Second.
Yeah, right. And there's great, like I said, I mean, a bike or a stepper, if that's what they can do for the intensity part, and you need to do some other stuff in sitting, get their intensity on the bike or the stepper. That's fine.
Okay. I like that. All right. Let's switch gears. Before we do that, let's just take a little quicksy break. Cool. All right. Taking a quick break. We gotta pay the bills, man. We gotta keep the YouTube on here. Thanks to our friends at Empower EMR. It's like the opposite of a clunky system that you secretly hate. Empower EMR is smooth, smart, and helps you run your clinic, not wrestle with it. Check them out at Empower EMR. That's empoweremr.com. And I want you to know about good causes. We love good causes. We want to give a microphone to the good cause. This one's cool. It's called One More Wave. They help wounded and disabled veterans heal through surfing. Yes, I can already hear the PTs wanting to volunteer. It's there. It's not just surfboards, though. They're taking custom adaptive boards designed for each vet. It's therapy, it's waves, it's purpose. Just check them out. Hit onemorewave.com to donate, get involved, or just watch someone catch a wave with a prosthetic leg and a huge smile, and try not to get inspired or maybe like shed a tear a little bit. So onemorewave.com. Let's change gears here with Phil. First of all, we got to paint the picture. What exactly is RTM, and why should people care? You found out in a magazine, and you were like, "This is great," and then you dove in. For the person who hasn't dove in yet, how do you paint the picture?
Yeah, RTM is just remote therapeutic monitoring. So it's just a way for therapists to keep up with what's happening outside of the clinic, pain, home exercise adherence. Some of them will do step counts, activity levels, and patient messaging, phone calls, or messaging through the app. So it's a lot of what we do already. If you're doing what I feel like I should be doing and creating programs and keeping up with the patient, it's just done in a way that's now billable.
Yeah. That might sound overwhelming. I've heard from people who've been like, I hear what it is, but that feels like it's adding a lot more work, which if you're doing a SWOT analysis, that's like a weakness or a threat. But if you're smart, like some tech companies, they look at it like an opportunity. Here's this road with a bump in it. How do I make it smoother? So there are companies who do that. Like there are organizations that go, hey, you do the PT part, we'll do the tech part. And when we merge, you're going to make more than you're going to pay us something because we're doing work, but you're going to make more and be able to help more even after you pay us. So I want to throw that out there. There are apps and we can suggest some or whatever, but that's out there. My next question for you is, I think we're past RTM is coming, right? It's like RTM's here, right? We're recording this at the end of 2025. Whether PTs like it or not, what's the opportunity here there? What should clinics be doing now to prepare for 2026 to 27, 28?
Yeah, so it's definitely here. It's not ubiquitous by any means. There's all kinds of places that have never heard of it. I talked to PTs that have never heard of RTM or remote therapeutic monitoring spelled out, but it's here and it's going to stay. CMS, not CSM, not the conference.
We're really
CMS,
smart. We're in healthcare. We name our conference CSM. Well, a lot of us deal with CMS, but yeah, I get it.
Yes. So CMS has made changes to the codes coming in 2026 that essentially fill some gaps that used to were some areas where you couldn't bill someone because they didn't use the app enough or you didn't interact with them enough. They filled some of those gaps next year. And from what I understand, anytime CMS is making positive changes to our reimbursement codes, like that means they're here to stay.
Let's go.
It's exactly. Yeah. It's rare, right? We're used to going in the other direction.
Yes.
But yeah, what you should do now is, you can reach out to me. I have a buddy named Matt Jurek who deals a lot in this area.
Matt,
I think, yeah. So he's a good resource, and there's tons of vendors. Like I have some that I prefer. We can talk about that off mic if you can.
You can give him a shout out if you want. Like I'm right man. Shout him out.
Yeah. So Orva is a great one. Orthopedic Virtual Assistant. I really like them. I've dealt a little with. They just changed name. I think it's Prompt Solutions. They're integrated into Prompt. So if you use Prompt, those are the two I'm most familiar with, but I've met with several different companies, vendors, so there's a lot. And some of them are just, I don't like them because they don't fit the clinic that I'm helping implement.
Some are going to be better for some things and different for other settings. Steve Cohen,
exactly.
Friend of the show.
Sarah is Sarah Health. Is that him?
SARA Health.
Yeah. Yep. That's a pretty popular one. You see him everywhere in the PT world. Like that guy is all over.
If you go to a conference, you do spot Steve. Have you seen him in person at a conference?
Yeah, I saw him at CSM last year in his like lime green suit.
He wears like the uncomfortably colored tracksuits. And I think it's like at first glance, you're like, that's ridiculous. And that's why he's doing it.
It is why he's doing it. I remember seeing him, so it worked,
Yes.
Yeah, but that one is more of a text messaging platform, so you don't have to have the smartphone use. You can, which a lot of these rely on apps. So that one, takes that out of the equation if you have older patients who you think can't do apps. But so reach out to somebody, find a podcast. There's a lot. That's how I started learning about it just a little bit. I listened to
Matt Jurek's was one of our most listened to episodes in 2020. It might have been the end of 23. I mean, we might have been talking about that long. But he came in.
That one, that's how I found him. Yeah.
He came in and was like, I understand this. And that's what he does. Like, not to get too much into Matt Jurek. He drives around the country in an RV with his family and just like does cool stuff. And then he jumps on a laptop and he does this for clinics. And he goes, they pay me and they're still making enough money to make the juice worth the squeeze. And I'm like, oh, this is intersection of opportunity meets elbow grease. And I love those.
Yeah, me and Matt met. He was in Arkansas when I reached out to him on LinkedIn, and we just kind of met halfway over beers and talked through the whole RTM thing. Learned a lot. So he's a great resource.
He gets it from two. Number one, he understands the technology enough, and he also meets you on the other side because he's a PT. He's like, I've been there. I've been on the other side. I know that this seems like it's going to be a pain in the ass, but watch me remove every one of your barriers or every one of your objections. And if we can do it this smooth, Would you do it? And when people, you have to commit. There is some work. There's going to be a lot of work at the beginning, and then the amount of work is going to fade out, and you're going to get no return in the beginning, but then the return is only going to compound. And luck favors the bold.
Yeah, and in a time, it's 2025, almost 2026. Everyone has gone digital in the world. I mean, airplanes, finance, those are big things. It makes sense. But like food delivery, the fitness world, like your smartphone knows more about your activity than your PT does.
Yes.
So why don't we utilize that to let your PT know these same things, right? Like the person who's guiding your movement and care should know what, just your app within your smartphone knows, or your Garmin watch knows. That's what RTM is trying to come from. It's trying to catch us up with the rest of the world.
Yep. How can people reach you? You said reach out to me. What's the? I'll put it. So I want you to say it.
Sure. Easiest way to find me would be I'll give you 3 ways. So my email is just PhilMcKelvy@gmail.com. I'm on LinkedIn, PhilMcKelvy, and then my Instagram is PhilMcKelvy.dpt. So you could reach out on any of those, and I'd be happy to talk to you.
Let's talk about you for a second. You juggle a lot. In your intro, I mentioned clinician life, education, entrepreneurship, advocacy, son-in-law to another PT. So I'm sure he's always watching. I'm sure he's always eyeballing. Keeps you in check. Your better half is also a physical therapist too. How do those roles feed each other? And what keeps someone like you curious?
Yeah, so I'm the kind of person that comes up with lots of ideas, and then I drop a lot of those ideas. But if something continues to excite me for while I'm learning about it week after week, month after month, I kind of run it past my wife. Of course, she's the discerner. I think you and I have talked about that before. Having a discerner.
Yeah.
But if it clears that path and I get some excitement from it or enjoyment from it, I just keep running with it until it stops. So you would think like, oh, he does I was an adjunct professor, been doing that for a few semesters. I do the public relations. It's Arkansas College of Health Educations.
What's your logo? What's the mascot? I judge schools by mascots and logos.
Oh, I don't know that they really. I don't know if they really have a mascot. They should get one. They have no sports teams. It's just like it's like but no. To my knowledge, there's no mascot.
We'll work on it. Okay, keep going.
We'll work on it. Yeah. So all of these things like add to they fill my cup. Like sometimes in PT the word burnout is everywhere because it's so easy to hit that. And dealing with patients with real problems and real sad things and that can empty your cup. So if you're not filling into it, now I do that with disc golf and with hiking and camping and stuff like that. But professionally, it keeps me excited about being a PT by working on outside projects outside of my, clinic job, 9-to-5 job. And within that job, I do some extra stuff there too. So the key to me is just finding things that you enjoy and going down that. And then if you stop and, if it doesn't work, then you just stop it. You're not a failure. You just, you kind of that fail forward mentality. Yeah.
This is Bear Grylls. This is Mythbusters. Yeah. You try stuff. You put it out there. You've seen that chart before where it's like success, how we think it goes. And it's like up and to the right. And then like how actual success is. And it's like, woo, 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 woo. It's all over the place, man.
And for me, like connecting with people is a real like fire, lights a fire me. So like reaching out to people on projects. Yeah. It helps, make me feel engaged and excited in whether it's APTA or outside of APTA or like within clinics, like
that's what the real superpower of APTA membership is. We've talked about this before. I've raged on it on LinkedIn. I'm not going to stop. You're not selling CEUs. You're not selling a newsletter. Sure. You're not selling journal access. You are selling what Phil was talking about right now. Companies
and it's powerful. Yeah. Like the PTs are great people. And for the most part, they want to like, you can reach out to people on Instagram on a post where you learn something. And these people can have 800,000 followers and almost all of them message you back. I figured that out, a decade ago when Instagram PT was like starting to become a thing. And I was reaching out to these people with like specific questions I couldn't answer. And they were just mentoring me via DMs on Instagram. Like
wild, right?
Yeah. And now some of those people are my friends. So it's just really cool. And so you can do that in lots of different ways. I know some people don't feel comfortable with that, but I encourage it. I'm like, look,
just one way.
Yeah. If they don't respond, it's because they were too busy, not because they didn't like you. It's no big deal. Like you're right where you are today.
Yeah. We're going to play a quick game. Are you ready to play a quick game?
Ready.
Neuro. Fact or fiction? So we'll go, Phil, since you're deep in the Parkinson's world, I'm going to hit you with a few statements. You tell us if it's neuro, fact, or fiction, and then you set the record straight. Coming in hot with 3. Okay. Only PTs with LSVT big certification should be treating persons with Parkinson's disease. Fact or fiction?
Fiction. LSVT big is great, and it really advanced how we see and treat people with Parkinson's in relation to amplitude-based training. But that would severely limit access to people in bigger cities or certain areas where neurospecialists are present. Like it's great, and those people get great care. But that's not where everyone with Parkinson's lives. So I want anyone who has Parkinson's or other movement disorders to get quality care, whether it makes sense for a PT in their vicinity to get certified or not.
Number 2, exercise can actually slow down the progression of Parkinson's disease. Fact or fiction?
Fact. There's a ton amount of animal research that shows this. Human research is a lot harder to do. They're working on the studies, but functionally, mood-wise, et cetera, it's going to improve everything. And all of the research I've seen and all the data is pointing in the direction that it absolutely slows down progression of disease.
Now we're going to twist it. We'll do fact or fiction, but this is about RTM. I'll slide an RTM question in there. RTM is just a billing trick. Is it a billing trick, fact, or is it it's not a billing trick, fiction? What do you think?
I'd go with fiction. It can be. It shouldn't be. I don't think people that are implementing it are using it that way because it's too much work to get going on to just make a few extra bucks. And it can really offset some Medicare cuts and make you some money. But what it is, it's a way to better engage your patients and a way to better understand their recovery.
There it is. All right, you're off the hot seat. That's fact or fiction. The last thing we do on most episodes, where's my button? I got a button. Here we go.
This is the parting shot.
All right, parting shot, your last chance for a mic drop moment. I want to say thanks to AOMT. If you know, you know. AOMT is where orthopedic manual physical therapists go to connect, grow, and sharpen their craft. Join the movement at aompt.org. That's AAOMPT.org. Thanks for supporting the show. Parting shot, your last chance for a mic drop moment. What are you leaving with the audience today?
I'm going to get off both topics and just say, work hard, be kind. So my dad was one of the biggest influences on my life. And if I could boil down everything I learned from that guy to be a successful human and have a happy life, work hard, be kind. It doesn't even have to be in that order. Be kind, work hard, and you're going to go somewhere.
Love it. You want to give a shout out to your state chapter as well? That's how we connected, was through your state chapter.
That is, yeah. So I'm from Arkansas. So if you're a PT in Arkansas, reach out to me or someone about being a member, what that means. We're trying to figure out what people want and don't want and make it better. So, reach out to myself or one of the other. Yeah, we're trying to grow it. So reach out. We can talk.
Love it. Phil, appreciate the time. Thanks so much for espousing some wisdom here on the Pinecast. Appreciate it, man.
I hope I had a little bit. Thanks for having me, Jimmy.